the topic of COVID-19 community isolation in Thailand. I'm Dr. Smai Sritong Thaworn, Deputy Director General of Department of Mental Health, Ministry of Public Health, Thailand. The outline that I want to share, the first one is the situation and service setting for COVID-19 case in Thailand. The second is the guideline for quarantine patient in the community. And the third is the example of the community isolation center. This is a picture of spreading and situation that we have to face with in the community. This is come from Upwell, Australia model. When the COVID-19 pandemic attack, there will be the first wave is an immediate mortality and morbidity of COVID-19 patients. Rather, the second wave is the impact of the resource restriction on urgent non-COVID condition. And then, rather, the third wave, the impact of interrupt service for the chronic condition. And the fourth wave is the psychiatric and mental health problem that happen almost immediately from the first wave, but persists longer than any other wave. Is the psychic trauma, mental illness patient, economic injury, and the burnout of the staff. The number of the COVID-19 pandemic in Thailand at the first or initial phase, the number of patients stay stable, but rather for some time, the number of the patients increased as an explosion of exponential curve. So, at first, when the traveler from abroad come to Thailand, they have to be quarantined in a quarantine setting. We call state quarantine and alternative state quarantine for 14 days, and rather they have eligible condition to free domestic travel. The definition of COVID-19 case. The first one we call is probable case. The probable case means the patient who have ATK or antigen test kit positive, both symptomatic and asymptomatic patient. The confirmed case is the patient who have positive RT-PCR method from the laboratory standard. The patient with ATK positive or RT-PCR positive have been categorized into groups. The first group we call green color group is a asymptomatic case. The second group is a yellow or mild case symptomatic group, and the red color is severe symptomatic case. The green group, we can separate them in the community, we call community isolation. And sometimes some people want to stay at home, we call home isolation. Anyway, both community isolation or home isolation are served for the eligible or definite condition patient only. And the yellow and red color group have to be admitted to the hospital. Right now, the situation changed already. For new normal lifestyle protection or prevention, we have set up the sandbox. The sandbox we start at the Phuket Island. The eligible traveler can come to Thailand with vaccination passport and health insurance and test with ATK or RT-PCR, and then they will stay in the certified hotel or hospital. Rather, after set up Phuket Sandbox, we extend for Phuket, staying for 7 days, and go to other extension island for the other 7 days. Not only the sandbox, in the general population, at the personal level or personal setting, we call the MHTTV measure. D stands for distancing, M for mask wearing, H for hand washing, T for always temperature check, and second T is a tracing or tracking by application Thaisana, and the last one V is the vaccination. At the organization setting, we set up a COVID-19 free zone in the organization, such as the factory, worker camp, or in the school, and we set a criteria or condition to separate them and to protect them in the safety criteria. The last one is the environment manipulation. Set up and good ventilation, transportation, and waste product disposal in the infection control system. Not just in the general area, but even in the psychiatric service system, we also set up the system for pre-visit of the patient, OPD setting, IPD setting, and modify ECT. Even the discharge, after discharge, we will set a telepsychiatry, and we have a medicine delivery to home. This is a new normal psychiatric service that we improve. The concept is to decrease service density, digital innovation platform, and safety from COVID-19. About the community isolation, the meaning is that massive isolation of medical and healthcare facility. The committee have been established by voluntary, and the people allowed committee must accept the patient and take care allow to 100 people per one center and arrange 24-hour monitoring. All the patients can be able to refer to parallel hospital in case of emergency. Also provide hygienic environment and manage to prevent the spread of disease. The confirmed patient or even the patient who have recovered from COVID-19 and being infected with COVID-19 with asymptomatic or mild symptom can be admitted in the community isolation. All age group can be stay together in the community isolation, and all infected people must assess mental health status too. People with mild or improved COVID-19 symptoms may have some virus in the secretion, mucus, or saliva. So these people must separate themselves at least for 14 days since the date of onset of illness. And they have to be controlled personal habit for new normal standard of living lifestyle. This is some picture of the community isolation center. We have CCTV and access the patient and communicate with the patient through telemedicine. And altogether 14 quarantine. And after that, we will have a final medical checkup before discharge. The operation process is to assess the number and severity of symptoms of infected case. We assess the high-risk population. We also set up the standard and assess the area for quarantine in the community. We also control the ventilation of the community isolation. We also check for the environment or food sanitation system. And we set up infection control system in the community and gas security system too. This is some example for community isolation center. We visit Wat Bolomniwat School Community Isolation Center. This center always check ATK positive patient, and we found that the day that we visit, there are 14 patients and one case of schizophrenia. And so many cases have a severe or stress or anxiety. This community isolation center also have a surveillance test. They have 30 ATK tests for the community surrounding. Up to then that we visit, they found only 10 positive ATK. Vaccination in that area is allowed 90% of population. We also suggest the center for psychological support. This is another big community isolation center we call Lat Buona Isolation Center. This center provides 200 beds, but the bed occupancy are only 50 beds. The patient transport by the municipal system team, and we can contact or access physical and mental health assessment by nurse via camera and live group. They also set up an examination room to provide specific patients who don't have personal mobile phone and they need a special examination room that can contact with the healthcare team directly. The mental health team recommend them for mental health checkup application and provide some guidance document for the mental health practice during 14-day activity in the center, and also provide bio-neurofeedback service for the personnel at the center too. And this is the two example for the community center. So always social distancing but we still connect together